Hey, what's up? Corey here. Basically, what I'm going to be talking about in this video is some of the most crucial things that you can do in order to treat your TMJ headaches, what causes them, why, and what you can do right now to start improving your TMJ. So, basically, what is TMJ? Well, um, TMJ actually stands for temporomandibular joint, which is your jaw joint. It's located right there in front of the ear. Okay. It's where your jaw joint meets the rest, or it's where your jaw meets the rest of your skull. So TMJ, when you say I have TMJ, well, that just means that you have. I mean, it's a couple different definitions. One, it means I've got teeth grinding problems. That's basically what it's been come to mean. But TMJ is actually means temporomandibular joint. So, anyways, now that we have that covered, what causes it? Well, it can be caused by several different things. Stress is a really big one. Improper diet can be one. If you get in a car crash and you get really bad whiplash, that can be one. If you have misalignments of your teeth, that can cause TMJ. So there's a lot of different things that can cause it. So, I mean, but for me, like, I don't really even know what caused my TMJ. Like, at the time that I got it, I was under a lot of stress, dealing with relationship issues and stuff, and then it kind of developed over time. Anyways, so there wasn't really that I know of, like, a direct causal thing. But anyway, I've ground my teeth basically my whole life. So, if you have TMJ, here's what you need to do to start treating your headaches. So, first of all, you need to understand what it is that's causing your TMJ to happen. Were you in a car crash? Were you under an incredible amount of stress? Because the TMJ headaches are kind of one of those things where they get worse before they get better. Like, and oftentimes they don't even really get better. They just keep on getting worse. So basically, but step one of TMJ treatment, okay? The first thing that you need to do before you start cracking teeth and wearing your teeth down to little nubs is get yourself a mouth guard. You can go to G.I. Joe's, Walmart, whatever, and get yourself a football mouth guard, mold it to your teeth, and wear that. I spent $2,000 from a TMJ specialist who sold me a mouth guard, and it didn't do crap. And basically, we're out 2Gs, and what else treatment can I get, after I spent that much money? So basically, from the same therapeutic effect, I could go to Walmart and get a football mouth guard, and I was able to substantially decrease my pain levels just by doing that, for spending about $8 and doing maybe 20 minutes work. So that was great, So I highly recommend doing that, because what you want to do is when you grind your teeth at night, it's hard surface on hard surface, and when you're grinding like that so much, that's a lot of force, and your muscles get tired and fatigued, and they get inflamed. So yeah, get a mouth guard. That way your teeth are at least separated a little bit, and they've got kind of somewhat of a soft cushion. So you're gonna help reduce your muscle fatigue and stuff. And basically, why you get the headaches and stuff is because your jaw muscles or your masseter muscles, they get so fatigued that they can't even keep up with the jaw clenching action anymore, that you're doing so much at night. So your temporal muscles, which are involved in when you clench your teeth or you bite into something really hard, it's your temple or temporal muscles that are doing all the work. So primarily, if you have chronic or maybe not debilitating headaches that are primarily located in the temporal region, you have and they're on both sides, not just one side, because if it was just one side and it was a pounding headache, it'd be a migraine. TMJ headache is dull, achy, you can get dizziness, hearing problems, your ears, check this out. Actually, I'm doing pretty good right now, but your ears can get all white and blotchy because of lack of blood flow flowing through your ears. Ear pain, these are all TMJ symptoms. So if you have a dull, achy headache, primarily in the temporal region, and you know that you grind your teeth or you clench, and you might also get tinnitus or ringing in the ears, chronic fatigue, um, stuff like that. You probably have a TMJ headache. So, how do we go about treating that? Well, I highly recommend going and seeing a neuromuscular dentist. Okay, basically what he's gonna do. They cost a lot of money. I spent $5,000. Okay, but he gave me one of the most advanced night guards that you could um, ever purchase. Um, so basically, I don't know. I'm going to talk about that in the next video, so please subscribe and check out this next video on TMJ night guards. Thank you.